especially nowadays with chemo, hormonal, targeted therapy or biologic therapy. So being a medical oncologist, I will focus more on this systemic therapy. So for treating a breast cancer, we need all these expert hands in the form of histopathologists, surgical pathologists, medical oncologists, surgical oncologists, radiation oncologists, as well as genetic risk assessment, supportive services. So what direct sequence of the treatment for a breast cancer patient? So it depends on clinical stage, pathological stage, and subtype of the tumor, biological characteristics of the tumor. Again, depends on many clinical features like patient age, histological subtype, grade of the tumor, tumor size, lymph nodal involvement, hormone receptor status. So the hormone receptor status, this is again available for us since last 20 years, but this has changed the paradigm of treatment of breast cancer in all the stages, early stages as well as the advanced stages. And of course, the development of anti-HER2 therapy. So roughly early stage, stage 1, stage 2, locally advanced stage 3, metastatic stage 4. So I'll just try to explain in a nutshell. So based on the biology of the disease, breast cancer is divided into three types. One is hormone receptor positive, the second is HER2 positive, third is triple negative breast cancer. That is, all the three receptors are negative. Each carries its own prognosis differently. So usually hormone receptor positive disease is considered to be a very good disease for the patient. If they have to choose out of the three, they have to choose the first one. And HER2 positive disease is definitely biologically very, very aggressive, and the prognosis used to be dismal before the anti-HER2 therapy monoclonal antibodies were available. But now, after the introduction and wide availability of anti-HER2 therapies, monoclonal antibodies like trastuzumab, pertuzumab, TDM1, the prognosis has improved drastically. And TNBC, of course, even now, if the patient has TNBC, it is a dreadful disease, because even if you give curative treatment for early stage disease patients, the chances of recurrence in the first 1 to 3 years are really high, because after the surgery and radiation and chemotherapy, we don't have anything for us to offer them in terms of hormonal therapy like that. So TNBC is still considered as bad prognostic disease. Yeah. So